Obviously, getting to my remarks, because of this unprecedented 1-2 punch to the rural West, a pandemic virus and a potentially brutal wildfire season, on April 30th, I joined 10 other Western senators asking for specific answers to the kinds of questions that are being raised here. And we've got to have answers for rural residents. We've got to have answers for these courageous firefighters. And late yesterday, the agency responded. Now, I'm glad that they decided they'd respond to 11 United States senators, but they used much the same language that we have heard, Madam Chair, this morning. We heard, for example, that they wanted to coordinate with state and local partners. So back again to these kind of word salad kind of ideas that really don't go to whether you're going to actually get the work done that my colleagues are talking about. And in fact, I was recently briefed in Oregon by the local partners, and they didn't give me any indication that there is direct on-the-ground coordination between DC Health and emergency services programs and the front lines of Oregon forestry. And in fact, Madam Chair, Ms. Castor, at your agency, the Department of Interior, when asked to commit to maintaining long-standing cooperation with the Oregon Department of Forestry in fighting fires, Secretary Bernhard just said no. Madam Chair, I'd like to make that written response a part of the record at this point. So my first question then is for you, Mr. Phipps. What specifically is the Forest Service going to do to really address these issues of testing and protection for the firefighters in rural communities using the Centers for Disease Control, the Federal Emergency Management Agency, and do it with people on the ground quickly, like I'm talking about the next couple of weeks? What is going to be done to get that help to folks on the ground quickly?
Thank you for the question. I think it's a great question. To date, our interagency medical committee has actually advised against testing. I know that runs contrary to a lot of people's understanding of why that would be the case, and they're concerned that testing is a snapshot in time, so that's why you have to do it multiple times, and its accuracy is...
Mr. Phipps, we know that argument. So what then is going to be done to protect the firefighters in these communities specifically?
We're relying on the social distancing and personal protective equipment, hygiene, moduling as one concept that had been mentioned. To date, that's without having this, what I mentioned, a robust capacity that's actually mobile that can come to a fire camp. You know, we're concerned that that could easily overwhelm local health facilities. So we have to do something as the interagency more.
You need to tell us what that something is within a week, and you need to get it to the chair and the ranking member, because to just hear about exploring and doing something and maybe we'll look at this, it's just not acceptable to the people who give us an election certificate.